if you are doing the West African program, what you have to do is first you write what we call primaries. Your primary exam will be in anatomy, physiology, and pathology with some principles of surgery. But anatomy forms half. Before you used to have essay and all this, but it's basically multiple choice question, the 1 out of 5. So if you're able to pass that, you have what we call primaries. That will enable you look for centers in the country that run the program in what we call membership stage. And that membership stage will allow you 3 years. You will write membership exam. When you qualify for the membership exam, you can now decide if you are coming into cardiothoracic surgery. And if you are coming into cardiothoracic surgery, then you will do basically 4 years to qualify. Now, this is what the program looks like. In the country, some centers have full accreditation. Some few centers have full accreditation, many centers, and some other centers have partial accreditation. So that will enable you come in. You will do program in thoracic surgery, you do program in vascular, and do program in cardiac surgery, both adult and pediatric cardiac surgery. Again, you will do some program in radiology, cardiology, and pathology to some extent. So this area, but their main training will be in thoracic, cardiac, and vascular. So when you have completed a period of 4 years training in the different sections, and we are quite interested in the volume of cases you are seeing, then you will be qualified to sit for the exam. I think there is also a component of dissertation in the exam. As you prepare for the exam, so there is also a component of dissertation that goes in during the period of training. So you have a research work you do, and then the final exam will mean that you have to be found, you have to satisfy the board of examiners in the dissertation you presented, as well as the other academic work. So it has two components. It has the dissertation, and you also have the clinical aspect that you will be required to satisfy the court of examiner before you advance. So basically, what it means is this, that from the membership to qualifying as a cardiothoracic surgeon, that we give you the, what I call it, the enablement of coming in as a consultant. You have a period of 4 years. Now that's for West Africa. Then we've now started the kind of sub-specializing, because just like Professor Hassan and other of my co-panelists will know, there are subspecialties even in cardiovascular and thoracic surgery. We have pediatric cardiac surgery, we have adult cardiac surgery, we have thoracic surgery, and we have vascular surgery. So this, you will do what we call post-fellowship training subsequently. But that will mean that you have finished your 4 years of rigorous and supervised training. I think I will stop here and listen to others make comment. Thank you.
Professor Kelechi, thank you very much for that insightful and detailed explanation about the program in West Africa. I would like to give the floor to Dr. Kudzai, if she's present with us. Doctor, you're welcome, and she's a cardiothoracic surgeon and at the peritoneal group of hospitals in Zimbabwe. I hope I spelled it well. Dr. Kudzai, can you please, are you with us?
Yes, I am.
Thank you very much, Doctor, for coming, and I'll kindly invite you to introduce yourself so that everyone here gets to know you and how about the program and in cardiothoracic surgery where you are. Thank you very much.
So I'm Dr. Kudzai Kanyepi. So I'm currently practicing in Zimbabwe at the teaching hospital that's called Parirenyatwa Group of Hospitals. I did my undergraduate training in Zimbabwe. So I completed an MBCHB program in Zimbabwe, and then I decided to specialize in cardiothoracic surgery in South Africa. So basically the journey in South Africa, or the steps to follow. The very first step is to get your primary degree accredited by the Educational Commission for Foreign Medical Graduates, which is ECFMG. I'm sure many of us here are familiar with that. So step one is to do that verification process. And you can only truly start the application process for South Africa once you finish your internship. So once you've gotten your completion of internship certificate, you start your ECFMG process. Once that's done, in South Africa, it's quite kind of similar to the West African way. But firstly, you have to find a university. So there are about 5 or 6 universities that train in cardiothoracic surgery. So you have to be applied to university and get accepted by that university. So there's the University of Witwatersrand or University of Wits in Johannesburg. There's the University of Pretoria. There's the University of the Free State in Bloemfontein. There's the University of KwaZulu-Natal in Durban, the University of Stellenbosch in Cape Town, and the University of Cape Town in Cape Town. So those are the training institutes that are universities that are accredited to train cardiothoracic surgeons. So once you apply to that university, they'll usually give you a place, and then the rest of the process begins. The third step to this process is what they call Foreign Workforce Management Program. So in South Africa, you need to apply to their management program so that they know which foreign workforce is working in their healthcare sector. But this is a process that involves you sending in forms and going onto their website. I think it's fwmp.co.za, and they will give you the workforce guarantee. So this is aided by the university you'd have applied to. You also need to get your Health Professions Council registration to train in South Africa. So that is also assisted by the university. So these processes, usually the university, once you've applied, they'll walk each student through the processes. When it comes to the actual training, so as the West African way, we have 3 sets of exams. It starts with the primaries, which are your anatomy and physiology. And this can be written soon after you finish your internship. There is no clinical rotations required for this exam. Once you've finished your primaries, you then need to sit for what we call the intermediates, which would sort of be equivalent to a membership exam. The intermediates you're only eligible to write them after you've completed 6 months of training in a general surgical program, 3 months in ICU, 3 months in trauma. So this is what you need before writing intermediates. And unfortunately, these rotations must be completed in an institution that is accredited with the College of Medicine South Africa. So you will find an institution. There are some that are not in South Africa that you can use. And if you find such an institution, then you can do your 1-year training before your intermediates. Or some universities will take you just with your primaries, and you can sit for your intermediates once you've started cardiothoracic training. To sit for the final fellowship exam, it will take about 5 to 6 years. It's a competence-based fellowship exam, so you keep a logbook. When I qualified, I think they needed about over 80 open heart cases, and I think numerous numbers of thoracic cases. The numbers have increased, so you will need to have that logbook filled in. for you to be able to sit for the exam. The exam is then a fellowship exam, and you become a fellow of the Cardiothoracic Society in South Africa. But to complete the training in its completion, you have to also have an MEd. So you also need to do a master's in medicine from the university that you'd have registered with. So as I said, you have to be registered with the university. So you also, at the same time that you're doing your fellowship, do your master's in medicine. Essentially, it's the research component to your qualification. So to attain your master's in medicine and cardiothoracic surgery, you have to have done some sort of research with publication, or you sent it for marking with the university. And so you'll come out with an MEd qualification as well as a fellowship qualification at the end of 6 years. I think that's the brief summary of training in South Africa.
Thank you very much, Dr. Kozai Kinepi. So if I want to summarize, if I get rightly, you said after finishing your training in Zimbabwe and you went through the USMLE and ACFMG accreditation process, which is required to be able to go for training in cardiothoracic surgery in Africa. And there are three sets of exams, that is the primary, the intermediary, and the final fellowship exams. And if I get you rightly, overall it takes a process of 5 years, and within that 5 years you have to be registered to the university and or follow some other accreditation process, and at the same time you have to take your masters in medicine, which is the research component of your training. I hope I got it right.
You got it right, completely correct.
Okay, thank you very much. So I'm going to invite Dr.
Sorry.
Senono Ale. Yes, Doctor.
I think one important thing that I must say about South Africa is when you come to train in South Africa, you occupy what they call a supernumerary post, which is an unpaid post. So it's something that people must be aware of and cognizant of when you come to train in South Africa. So you will be training, but you're treated as a student, and so you're not paid for the time you're in South Africa by the South African government. So it's ideal that your government back home sponsors your training, or you find a sponsor to sponsor your training.
Okay, that is very, very difficult to be considered, because I guess most participants will have such questions. Please, if you have your question, just write it down in the comment section. I'm going to read it out to our participants. So I'm going to invite on board Dr. Senono Ale. He's a thoracic and cardiovascular surgery resident at the University of Nairobi, Kenyatta National Hospital. Dr. Senono Ale, please, if you are on board, kindly unmute yourself and introduce yourself so that panelists may know you more and give us a brief overview of your program. Thank you.
Thank you very much for this opportunity. I'm Senono Alan. I'm originally from Uganda, but I'm training in Kenya. I'm a thoracic and cardiovascular surgery resident at University of Nairobi. So most of what the other people have talked about is similar to what is happening in East Africa. Despite the fact that cardiovascular surgery is practiced widely, we don't have a lot of training centers in East Africa. For example, in Uganda, despite the fact that we had the Uganda Heart Institute, we don't have a training center for surgeons, cardiovascular surgeons as per se. So actually, the outstanding institutions you find there in Kenya. So still we have two routes, more of like the integrated, where the person does straight 5 years with the university, or the collegiate system, where people are attached to institutions that are accredited by COSEXA, the College of Surgeons for East Central and Southern Africa. So one, the collegiate, we have people trained from Tenwek Hospital. It's one of the biggest cardiovascular centers that we have in Kenya, and the program is 5 years. Then the other, which is the residency, which by the university, it is at University of Nairobi. That is the integrated route. Still, it's as well 5 years. So maybe I'm going to talk more about the integrated route of cardiovascular surgery. So yeah, basically, the road is similar to most of the other admission processes. They are what I would consider to be pre-entry examinations, but similar to the primaries the other people have talked about, which mainly have a bit of basic anatomy, physiology, a bit of principles of general surgery and cardiovascular surgery. Then after passing that exam, then the person will be submitted to an oral interview. Basically, it's just getting to know you, the person, and basically the person, basically your motivations and all that. Then after you get into the institution. So the program is 5 years. Along the way, you have to have a logbook, which is logging the cases, just like all the other residencies. There are sets of exams, one to do principles of cardiovascular surgery, which is supposed to help you move on from your third year. And then you're supposed to have your dissertation done by your third year before you progress to the next year. And in the final year, that's when you do practice of cardiovascular surgery exams. Still competence-based. You have to present your logbook with a certain number of cases done. And as well passing those exams before you are released by the university. Then from the medical board of Kenya, before one is considered a consultant, they are supposed to work for 2 extra years after completion of their program, and under the known already registered cardiovascular surgeons within Kenya. And then it's only after that period that they are registered as consultant cardiothoracic surgeons. So still the exposure is similar to most of the other programs. You have exposure in cardiac cases, thoracic and vascular. Because we have practice in multiple hospitals and training in only a few, you find, like for example, University of Nairobi, there are multiple external rotations where the residents have to go and rotate in other facilities because maybe they have a superior vascular surgery department, or they're doing things that are not done elsewhere, just to have more and more exposure. Yeah, so I think basically that's it for the training in Kenya. Yeah, I welcome any questions in case there are any. Thank you.
Thank you very much, Dr. Allen. And I think it's quite understood by the participant that the program in West Africa, in East Africa, is almost similar to that of West and South Africa, and it's 5 years. So I'm going to get back to Professor Hussein, and I want to find out what are the requirements for people coming out from around Africa that did not do their medical training in Egypt, and also other international medical graduates. What are there some specific requirements that they need before they can get into training in Egypt?
Thank you. This is a good question. I think I also see in the chat box that this is a question is repeatedly about the how does the international medical graduate get into training in Egypt? The usual form now that Egypt is having something like the USMLE of United States. It's an Egyptian medical student license exam after doing the internship or the house officer period, as we said in Egypt. And most of the time, if you are applying for the university academic fellowship program, you have to contact the university, and the university will be the responsible body most of the time to finish the working permit for you, or you get an advanced letter from it to the authority, and they give you the license for practicing medicine in Egypt. For the fellowship program, you will go through the Ministry of Health, and the Ministry of Health should give you this access so you can start your training program. And the point is that these kind of jobs in Egypt is non-fundable. They don't give you a salary for this training. So most of the time, if you are in an academic program in one of the university, you have to pay for the training. So you have to have somebody to fund you, either your primary university if you are coming from another university outside Egypt, or you have a specific program or fellowship travel funding. So this is for the funding question. And there was also another question about the quality of the fellowship in the Egyptian fellowship program. Is this like the academic universities, especially the large, well-known universities like Cairo, Ain Shams? Actually, the Egyptian fellowship program is mainly depending on the places that the people will be getting training in. So most of the time, the Egyptian fellowship, like for cardiac surgery, in high-capacity centers like Nasser Institute, they have a very large number. They have a 4 operative room, a large ICU, and they have a large number of patients, and they accept emergency cardiac surgery. So you will have a very good opportunity to have a large number of patients, exposure to good surgeons. So it will be very nice. For the thoracic surgery, after the COVID era, most of the chest hospitals that were running a large number of cases for thoracic surgery within the Ministry of Health is not working, probably because they transferred this hospital into a kind of isolation. So, and they did not return back to the normal ordinary work after the COVID had vanished. So the quality of thoracic surgery is not that much like the ones for the cardiac so far, but we're aiming that it will be much more. But what I can suggest, and most of the people is doing that, is that they have the master degree from one of the universities, and after this they transfer to the fellowship program. So they cut from the 6 years program of the fellowship 2 years, and they continue and they get the fellowship, especially for the ones who's like to have the cardiac surgery is much better. For the thoracic surgery, it depends about what type of operation or what type of surgery that you want to work in. Some centers in Egypt is doing like more cases of esophageal surgery by thoracic surgeons. So if people are interested in this, they will go like for the Alexandria University thoracic surgery service, because they have the predominant cases all over the country. Some other places that have a large number or scale of trauma patients. So because they have like a trauma hospital like Asyut, my center. So it will depend on the subspecialty that you want to work in. Shall I go for the other questions, or it's not mine? Okay.
Thank you very much, Professor Hussein. I think I will go directly to the second question, which is, which for Dr. Okinyefi. I think she explained it, but maybe she can reiterate about the training program and the requirement for international medical graduates and from people coming out of Africa.
Yeah, I think I outlined it as a summary. ECFMG verification. Apply to your university that has got a cardiothoracic surgical program. Register with the College of Medicine South Africa and do your primaries, and the university will help you with the rest of the paperwork. And as an international student, you have to fund your own studies. For the people in East Africa or in the COSEXA region, which is the Southern East African region, there's also the option of doing it with the colleges of South and East Africa. So COSEXA, which I'm part of an examiners of. So the COSEXA program, you'll have to have general surgery as a primary degree before you do cardiothoracic. But the places for cardiothoracic training are very limited and are done at Tenwek in Kenya. So those people who are residing in Tanzania, Burundi, Rwanda, DRC, Malawi, Tanzania, Ethiopia, Namibia, Angola, Zambia, you have the option of also doing the COSEXA pathway, which just requires you to do general surgery first.
Okay, thank you very much, Dr. Tinyepi, for this insight, and it's really I'm really learning that because I generally what I thought is that most programs generally needed a general surgery degree before going into it, and coming to understand that in South Africa, it's after getting your ECFMG credential, you can go directly to cardiothoracic surgery training. So there is a question for Professor Kelechi. Someone is asking for the Nigerian pathway, what are the implications of beginning core surgical training up to MWACS level in a center without full accreditation for cardiothoracic surgery training? And also, he will appreciate more clarification on the possibility of post WAC training in cardiothoracic surgeon outside the country.
Thank you so much. I think I will answer it simply. There is no implication doing your posting up to membership level in a center that does not have partial or full accreditation. Because, as I said earlier on, the 3 years for membership is for you to have some understanding in general surgery, urology, orthopedics, trauma, accident, just basic care. So you are a specialist. So you could do it in centers that have accreditation for membership program for West African College of Surgery. However, when you are now coming up for fellowship level, you must do it in a center that has accreditation, either partial or full. Then if it's partial, you may now require to complete your further training in centers that has full accreditation. If I have answered as they say, the possibility of post-membership training in post-membership training in a cardiothoracic outside the country. Yes, the main reason for post-membership training before this time is for you to get more volume in terms of hands-on in cardiac surgeries, especially pediatric and adult cardiac surgery. That was then when we were training. So you were required to go out for 1.5 years in areas where there are volume, case volume. You will have a lot of hands-on, especially in pediatric and cardiac surgery. But now, last time we have what we call joint accreditation. We pooled centers that are doing pediatric cardiac surgery, adult cardiac surgery. So most of our post-membership residents or pre-fellowship residents could have enough hands-on in those centers. So, but if you are opportune to have a center like Professor Hussein is saying in his center, and he's able to take you for 1.5 years, so that you could have, you could see so many cases for cardiac surgery, that could be accepted, especially when, just like they stated in law, we have certain kind of surgical procedures you are meant to have assisted, observed, or taking part. Well, if those areas are covered, we will also consider it. And before you go, we want a situation where we will also understudy and understand their spectrum of cases. So you don't just go doing one case that we can conveniently do in this country. I think that's for that. I think I saw another question. If you don't mind, I could just read them and answer. We said after writing primary exam, after writing the primary exam for West African, can an individual have the initial 3-year training in any hospital with surgery accreditation or have? No. Yeah, then we have the West Africa gives accreditation, partial or full, for membership. They give accreditation for partial or full for fellowship. So if you are having your pre-fellowship training in a center that has full accreditation, you could finish there. Then thereafter, you come to centers where the centers that have full accreditation for cardiothoracic surgery. Now, another question is: does the national postgraduate program takes the same format you described? Basically, that's the same pattern. Then number two, in low volume centers, how does the trainee get to navigate the required volume of cases? In low volume center, especially for fellowship, the basis for giving accreditation, full accreditation to a center is we have, I go for accreditation for West Africa. I'm also an examiner at both membership and fellowship level. For we to give you accreditation to train, we would have seen your spectrum of cases and volume of cases. So that means that over a period of time or years, you have adequate number of cases and manpower to train residents. So the issue of low volume will not come in, because if you have low volume, you won't be given accreditation and you won't be training residents in the first place. So for you to train residents, you must have adequate volume. So if you are training in a center that has a low volume, it then means that your training will not count. You can now go to another center that has more volume for you to. I've heard instances where trainees have to go to center abroad to complete their training. Do they have to personally well, two things. Just like I told you, like personally, I had to travel to India for 1.5 years to complete my cardiac training. You don't have to fund it because it's believed that you are training for the country. So what it means simply is that your center will make some provisions for you. We have so many candidates who have gone out, especially pre-fellowship training. The centers fund it and they still pay you your full salary so that to enable you to acquire the skills and qualify for the exam. And let me state this again. For instance, in our own setting, once you have our primaries for West African College of Study, you can train in any center in West Africa, and if you are given opportunity. And the interesting thing, unlike what I heard in Kenya, South Africa, or Israel, they will pay you in as much as you are dispensing services at those centers. For instance, if you have primaries of West African College of Surgery and come to my center for training, in as much as you are dispensing services, you will be paid. So I will still encourage other people to embrace the West African pathway, because we encourage people, once you have your primaries and you are working and you're having our qualification, you will be paid as you work. I think that's just the difference. And I will encourage other African countries to do the same. Once somebody is working, there is no need saying your home country should pay, because the person is dispensing services in your country. It's working. If, for instance, if I'm a surgeon operating on HIV patient and suddenly get a prick, it's from your patient I'm getting the prick. And there should be that understanding that the person should be taken care of, sort of. Thank you.
Thank you very much, Professor Kileshi. I think the take-home message from many of us is that you should join the West African College of Surgery program, because actually you are being paid. So we will embrace other countries to do the same, because it will really encourage many students and future cardiothoracic surgeons to consider the training, because one of the main challenges that we are facing as aspiring cardiothoracic surgeons is the funding for the training, because many people come from countries where the government would not be ready to fund your training directly. So if other training programs go adopt similar methodology, it's going to go a long way to increase the number of people, or the number and volume of surgeons that have been trained locally in Africa, without our expertise and skills going for other countries and staying there. So I'm going to pass on the mic to Victory if you're going to continue with the questioning. Victory, you have the floor.
Okay, thank you so much, Frank Barry. So this question, before I even go ahead to ask this question is to Dr. Senono. So I want to get this clarification, and that's the integrated program that's done in the country where you are. does that mean that you're actually bypassing the general surgery route?
Yes, that's true.
Okay, so if you're bypassing the general surgery route, how do you need to have like an excellent, let's use an excellent CV or profile for you to be able to reach that integrated program? Let's use I'm trying to my question is I'm trying to compare this with what happens in developed countries like the United States, where they have the integrated program. Do you get? So does it mean that this person must have like a very excellent extracurricular life, research wise, aside passing the exams, doing excellently well in the exam? What qualifies this person to enter, instead of going through the general surgery route, to enter the integrated program?
Okay, actually, allow me just take back something small. You're not exactly bypassing the general surgery route, because in the integrated program, the first years of your training, you're actually doing the general rotations where you do general surgery, you do a bit of pediatric surgery, ENT, and like I said, you're not bypassing as such, because you're still going to go through those rotations with the aim of picking the principles from there. So going back to your question about the person's CV or what they would have done, definitely your experience in different spheres of medicine, especially in surgery, will give you a bit of a nudge when it comes to the admission process. But I would not say that it is a must-have criteria. Like I would not say that those who do not have a particular number of years of practicing in a surgical center will not be admitted. Yeah, so it gives you an advantage over the other people, but it does not necessarily mean that the other people will not be considered. Yes, and yes, like I said, you do not necessarily bypass it. Maybe what I can say, you will not go through you'll not go through a formal general surgery training of 3-5 years, but you'll still have to go through those rotations with the aim of picking the principles of general surgery, principles of pediatric surgery, because you're going to be working with children in congenital heart, ENT, because you're going to have to learn the skills of bronchoscopy, osphaghoscopy, among other things, and so many other things. Yeah. So I hope I've answered your question.
Yes, you have answered the question. So the next question is, for someone who is not from the country where you are, where you're training currently, you said you're from Uganda, but you are not practicing there. For someone who is not in the country where you're currently training, let's say I'm in Nigeria and I want to practice in the country where you're currently training, does this person necessarily have to write, let's say, the national exams of that particular country to actually be certified that, oh, this person is qualified to be a medical doctor, before actually going to write whether it's the postgraduate exams that will take the person into residency?
No. So by applying for residency, you are already a qualified medical doctor. So the university would require of you to present your registration certificates, licensure certificates, among other things, but you will not be required to write an exam in the country, except if you are planning to get a permanent registration in Kenya. That is when you will be required to write an exam in order to get that permanent registration in Kenya.
Okay, thank you so much, sir. So the next question is to Dr. Kuzey. And this question is, are there situations where in South Africa, are there situations where a trainee would have to go outside, just like what Professor Kelechi said that sometimes happen within the West African part? Are there situations where trainees have to go outside, let's say India, or any other India or any other country outside Africa to go and to do like a 1 year program or 1.5 years program, maybe because of just to gain more, where they have like high volume of cases?
So in South Africa, generally, all the centers are high volume centers that train cardiothoracic surgery. But for example, so they're all based in major cities. All of the universities that train cardiothoracic have a very flourishing thoracic program. They've got congenital cardiac and they've got adult cardiac as a basic minimum. In Durban, the government hospital doesn't do heart transplant, but in the private sector in Durban, you can certainly assist and witness heart transplant in the private sector. Whereas in Cape Town at Groote at University of Cape Town, they do heart transplant in their program. But you can imagine heart transplant is not part of your primary qualification. That's almost a sub-spec. So for your primary qualification in cardiothoracic surgery, you don't necessarily have to leave your home institution because there's a part you haven't been trained in. All the institutions that are accredited by colleges of medicine South Africa have a high volume and also train in all 3 disciplines. CMSA is very rigid about how many registrars can be there per trainer. So you'll find that they will tell you that, no, we can't take any more registrars. It's because their training ratios have to be kept to the standard, and CMSA makes sure that they check that standard. So that's the only reason why supernumeraries aren't taken in a large number. It's because of the ratios.
Okay, thanks so much, Ma. I think I got that very clearly. Thanks so much, Ma. So the next question is to Professor Kelechi. So this question is, how competitive is, from the general surgery route, after person finishes from general surgery, how competitive is it to enter cardiac surgery? That's the first question. The second question I want to ask is, you mentioned the issue of logbooks when the person has to probably sign some particular cases where this person observed, performed, or assisted. Well, I know that there are sometimes we have situations where we have NGOs, humanitarian services outside the country that come to help out, or that come to help out in certain places where maybe they don't have the specialists or they don't have the equipment to handle a particular case. Now, in that situation where these particular NGOs or humanitarian services come in, and this particular whether it's a resident, a senior registrar, or a senior resident doctor assists in that surgery or is part of that surgical team, are they at liberty to sign that particular those particular cases, since they are humanitarian services?
Okay, thank you so much. And when I answer your 2 questions, I will make another comment that I think that should form the main fulcrum of this meeting. One, it is very competitive in the sense that, for instance, if you have full accreditation, you may be given the opportunity to train 4 or 5 residents. And now, when you have so many people clamoring to be cardiothoracic surgeons, there's rate limiting step in terms of the number of opportunity given or spaces available. Then, even for partial accreditation, like University of Port Harcourt has partial accreditation to train, we have limited number of persons and limited number of years we are going to train. That is quite competitive. Then now, talking about a senior registrar getting his logbook filled up when, for instance, he assists in doing a case for cardiac mission. The training we accept, the one your consultant supervised or your consultant is around, because there is the need for gatekeeping, sort of, so that somebody don't just go fill in so many cases and come to tell you that that's the case. You are consultants to supervise, and in most cases, the kind of mission we have is done in teaching hospitals and centers with either partial or full accreditation for residency training. And when those cases are done, yeah, if depending on the availability of the chief resident or the senior registrar, that could mean that the resident can feel the case as having assisted or having observed, as the case may be, or even performed. So that point should be noted. However, if even if you assist or you travel out to go and do a center that we don't have our eye on, it may not count for you. So whenever you are going out for training, it is incumbent that your consultants or even your center will advise you to go to places where it is recognized. We have places that will recognize and allow our residents go, so that when they come, it can count for them. So you don't just go out to train. I believe I have answered your question. Now, the point I should make, and we should consider seriously, is that we have people from different parts of Africa in this forum or in this meeting. What we should do is that there are artificial barriers that prevent people from achieving or gaining training across the sub-Saharan African region. I think that thing should be broken by the mere fact that this program has been on and have a collection of all African students who are aspiring to be cardiothoracic surgeons. So I would want to encourage that whatever be the case, at our different centers, we should create a forum where if somebody from North Africa wants to train in West Africa, he could have, in as much as he has done the basic exam, so that, just like you stated before, if somebody has finished training or has done training, you wouldn't start all over again. Like Dr. Kutzai Kayepi made one statement. Yeah, there was a time we allowed, I think COSEC or something, she said, we allowed them to come to West Africa to observe and also sort of validate some of the exams we are doing. I believe that even North Africa, South Africa, and East Africa, Central Africa, we should have that kind of platform where you invite people over to come and validate and understudy your system, such that they could talk to their people, and when your people are coming, that barrier will not be so much. So that if somebody wants to go and practice in Egypt with Professor Hussein, it will be an easy thing. If somebody wants to go to Kenya to practice with Dr. Alan, it will also be an easy thing. And if somebody wants to go to South Africa / Zimbabwe to practice with Dr. Kayepi, it will not be a difficult thing. So what I would want to encourage us is that we should start early, telling our students what are the requirements to bringing them into our programs, so that when they come into the program, we will have a cross-fertilization, and by so doing, increase the number of cardiothoracic surgeons in Africa. Thank you.
Thanks so much, sir. So the next, this question on the chat box is still for you. The person is saying, how can one know centers abroad outside Nigeria, example, India, etc., that are recognized by the West African College of Surgeons as acceptable training centers?
For me, how we know? Well, you see, there is this statement that you can't hide pregnancy for a very long time. One, most of the centers that are doing well, you always hear their names, But basically, if, for instance, they are traveling out, but what we have done is that centers we know. In fact, in some cases, you send the consultants or the trainers, let me use the word, to those centers to go and see their setting. So when the trainers come back, they also give us feedback in West African College of Surgeons as per the availability of resource in those areas. So it's not an arbitrary thing. We realize that at centers, some of our residents could go. They will not allow them to have hands-on. By that, we are not gaining, because the essence is that you are sending somebody having shown enough competence and having shown enough interest, having shown enough understanding. You will allow the person opportunity to gain skill and to deploy those skills gain. So in centers where they don't allow our residents to perform, then when you see, we frown at the fact you see your logbook, you see observe all through. There is no one that you were assisted to perform, and there is no one that you performed alone. Then the person is not training, because in any case, you are training the person to come and perform. So if he goes to a center where what they call clinical observership, he's observing from afar, what they call clinical observership is not acceptable. So that's why we have taken a great deal of interest in knowing the centers our residents go, and if possible, we go there to still observe them do things and satisfy that the center they have the opportunity to gain what we call hands-on before we can accept or satisfy this place as a training grant for our residents. Thank you.
Thank you so much, sir. So this particular question I'm going to ask will not only go to you, but it's going to go to Dr. Kuzey and Professor Hussain. I think after you, we'll start with Professor Hussain before Dr. Kuzey. So this question is, so in West Africa, I know that we have some French-speaking countries. So how does the college navigate these people that are from core French-speaking countries? That's regarding, I'm trying to talk about the language barrier. How do you solve the issue of the language barrier?
Thank you. It's a good question. Most of the time, those people who are speaking French is going to countries that having a training program that, or the French is one of the primary languages. So if somebody from these countries try to have a training in Egypt, most of the time they need to speak English, because they are studying medicine in English, not Arabic also. So if you like to have to practice medicine in Egypt, you will need to see the records, to gain the sites for reports, radiology, operative notes. You need to do this in English. Despite the fact that you will need to speak to the patients if you will allow to in Arabic, but you will need English. So most of the time, people I know that try to get training for this usually go to Morocco, Tunisia, and North Africa, because they are speaking a good French. Most of the time, they try to, if they want to extend their residency or training in North Africa, they choose countries that have this kind of opportunity. The good thing is that from 2 years back, some of the societies that work in thoracic disease and thoracic surgery try to have in their conferences, they try to have a francophone track. So they have discussions, research, everything for the francophones. I think this is a good opportunity, and I think that this can increase the interaction for those people who's trying to learn and to interact. But also, to be honest, the English is the main language for the medical literature, for publishing and for communication. I would advise all the medical students, even if this is not their primary language, to practice some English, medical English, because this is very important. And you can see a good example of this in the surgeons and doctors coming from far Asia. The English is not their primary language, even not a second, but they have to now to practice it more, and this help them much to like publish and to communicate, to attend the international conferences, to keep on the level with their peers in the other countries.
Okay, thanks so
I think
much.
I'm sorry, but if we will have time, I think we will need to speak about that, like the opportunities. I know this session is about the opportunities within Africa, but I think that we need to expand the boundaries, and people need to to have nodes how to communicate or how to join other international societies for cardiothoracic surgery, for example, especially that some of these societies now is targeting medical students. So they put the membership for very low fees. Is a topic that we can discuss later.
Thanks so much, sir. So,
or if we have time.
Okay. Dr. Kudze, can you also speak on the language barrier? As regarding COSEXA.
Well, COSEXA is based in the southern African, Central and East African countries, and you're generally doing your training in your home country. So that eliminates that language barrier. But it's not an integrated cardiothoracic program. You'll have to do your general surgical program in your home country. So if you're French speaking and you take that time during a general surgical program to learn English, so that when you get into a cardiothoracic program for the following 3 years, you're at least a bit better in speaking English. That's the COSEXA program. So it's advantageous to those that are French speaking, Portuguese speaking, that can do the primary training for general surgery in their home country. Then at that time when they're doing their training, also perfect their English before going to a cardiothoracic training institution. In terms of South Africa, the main mode is English. However, I must say there is so much diversity in the cardiothoracic program in terms of where people come from. So in my time, I trained with a Libyan. There was someone from Namibia. There was someone from Nigeria, Dr. Olubemi. There was a gentleman from DRC, Dr. Kampetu. But yes, even Dr. Munir, who came from Libya, had to learn English. So it's something you have to invest in. Dr. Kampetu from DRC had to learn English. But there's always a lot of support for those that are coming from far off African countries where English is not your primary language. There will be support in the university to help you get over that hurdle.
Thank you so much for the clarification. So these last two questions coming from my end before I move the mic to Frank Abaiwe is going to go to Dr. Senono and still Professor Kelechi. This question is, what role, before moving from the level of, after completing your residency program, probably going to the fellowship program, is there a role of attending conferences? Aside passing the exams, is there a role of attending conferences, whether it's national conferences, African conferences, or how do they call it, international conferences? Does that also play a role in that let's call it a promotion from the residency level to the consultant level? Let's start with Dr. Alan.
Can I answer?
Okay. Yes, Prof.
Sorry. I can go ahead.
Yes, I can go ahead.
Okay. Yes, there are two major and mandatory courses or conference. A senior registrar who is aspiring to be a fellow or of cardiothoracic surgery should attend. One, for West African sub-region, what we call research methodology. Remember, they are doing their dissertation and they must understand the basis of and advanced level of research. So they will attend that research methodology and have the certificate. You put the certificate before you apply for the exam, because we don't want any errors or someone saying that he or she was not able to attend that and thus could not perform his research according to top standard. Then two, that's what we call integrated residency course. It's a conference. You attend it in undergraduate level. In fact, at pre-membership level and pre-fellowship level. As a matter of fact, in the pre-membership level, there is still other courses that you attend, ATLS course and all those things that you must incorporate. Now, for this integrated course, it's a way of, talking about some topics in cardiothoracic surgery by a resource person. I have been with, as a resource person for a very long time. We take some topics, rheumatic heart disease, adult cardiac diseases, all those we teach it at the residency course, integrated residency course. So you get a certificate. Those courses last for 2-3 weeks. You are given a certificate you will incorporate when you are applying for the exam. As I haven't done those. So these are the two major courses. Apart from that, you could also attend West African college conferences. For instance, when you qualify as a membership, when you qualify your membership exam, you attend where you will be inducted during the convocation. Then during the meeting, there are opportunities for you to attend different courses. But those ones are not, it's just the mere fact that you are appearing there. Then there are other courses in cardiothoracic surgery, like every year we have our AGM and our scientific conference that will require the residents to attend. So in order to allow the residents opportunity to attend, we don't allow them pay so much. As a matter of fact, when they have papers to present in those conferences, we take care of their accommodation, their feeding, and give them some stipends. So those is just a way of encouraging residents, pre-fellowship people to participate in conferences. We have a provision for them to have stipends, and though it's individualized, and give them a rebate in their conference fees and may provide accommodation for them. So these are some of the areas we help our fellows. Thank you.
Thank you so much, sir. So I wanted to ask Dr. Alan. Is this same thing with the Eastern African parts of Africa, the eastern part of Africa, or are there any unique differences?
Okay, so about the conferences, I presume the question is still about the conferences, right?
Conferences.
Sorry? Okay, yeah, so the conferences, like I said, in this current day and time, we usually have conferences as a way of communicating new findings, science, research, among other things. So the conferences are definitely beneficial, but mainly on an individual basis when it comes to this side. So it's mainly for you to acquire the knowledge and connect with colleagues, among other things, but it does not necessarily contribute to your academics, like what they use to grade you. Yeah, so the part of research, like I said, okay, partly we do a research course just when you've just gotten into the postgraduate program. But like I said, before you proceed to your fourth year, you're ideally supposed to have done your dissertation proposal sorted and already approved by the department. You have multiple journal clubs just to keep you in check, where you're going to be critiquing different journals and all those things, to keep people in the loop of research and how research is done. So for our case, when it comes to the bit of research, there is that a short program that you do at the start of the a short course you do at the start of the program. They do not award a certificate, though there is an exam, and then multiple journal clubs, which are twice a week, different. For cardiothoracic surgery, they have one on Monday, and then there's one for general surgery on Thursday. So every week you have at least 2 journal clubs going on. And then also you have to present your dissertation before you proceed to your 4th year of residency. So I think the things are quite different. You would not have to attend conferences for the sake of progressing in your academia, but it's definitely contributing a lot in terms of your knowledge and being up to date with what's happening in the world. Yes.
So much, sir. I think Frank is going to take it up from here.
Thank you very much, Dr. Hassan Alana, and thank you very much, Victory, for mentioning the session. So I'll go straight away, and I think I'll take the question directly from Professor Hussein Map when he mentioned about other opportunities out of Africa and other organizations. Then I'll start with this question. Professor Hussein, what are the opportunities that are available for trainees after completing their training in Egypt? That is, in terms of the countries in which they can practice apart from Egypt, and also the pay package if they are willing to work there in Egypt. And also the second question will be, what are the opportunities in joining other international surgical society, and how easy is it for those fellows that have been trained in Egypt?
Okay, for the opportunities inside Egypt, I think most of the good opportunities are attending conferences and workshops. As Dr. Sununu said about that you will need to keep up with the updates in your subspecialty or in your specialty, and this can be done through the attending workshops, because as more you are grown up and you get old, it will be difficult to spend 1 or 2 years in another fellowship after you complete your formal training. But it will be nice to have a small clinical immersion, observership for a specific technique or a specific operation. You can attend a conference which they put the highlights of the new technology and how to deal with things. Or you have to attend a hands-on training for some new techniques or to refine your technique. So these opportunities are available. Most of the time you will need to join one of the social media platform for one of the societies that work inside these, in Egypt, we have the Egyptian Society for Cardiothoracic Surgery, for example, and some other integrated conference with cardiology Cardio Egypt, Cardio Alex, or integrated with the other chest departments or chest disease and tuberculosis, the Egyptian Bronchology Conference. And we also, I think the next year, the upcoming year, we will have the Pan-African Thoracic Society meeting that is held every 2 years. It will be next year in Egypt. So this kind of opportunity, this is inside Egypt or inside Africa. And the merits of this is that most of the time the disease spectrum that we are dealing with in Africa is near similar to each other. So we still have the tuberculosis, we still have the rheumatic heart disease, more than the most of the other countries in Europe and United States. But for the second part of the question about the opportunities outside the continent, outside Africa. So here you can have from the very beginning for the medical student level, some association or societies like the European Society of Cardiothoracic Surgery. They provide like a pre-training prescription or pre-training membership for the medical students for a very low amount of money annually, and this can give you an access and you can expose to the new things in the field and some free webinars. So I think this is a good investment. You can also follow some of the websites or platforms that works in the field, like CTSNet, Cardiothoracic Surgery Network. So by this, you can follow the new upcoming, and you can have some opportunity to get a fellowship travel grant. And there is all the time there is some kind of fellowship or travel grant that can provide you some fund to have a clinical immersion, long time fellowship, short time fellowship. So I think it's a good opportunity from the very beginning, from the medical student level, that you go through this kind of engagements.
Wow, that's really amazing. Thank you very much, Professor Hussein. I think I'll ask similar question to Dr. Kudzai Kenyepi. Given that you did your training in South Africa and the requirement is the ECFMG certification, maybe the question that is pondering my mind is what are the opportunities after training in South Africa? Can you work in other countries apart from Africa? Let's say maybe, for example, the United States, given that you have to fulfill the ECFMG requirement, and if so, what are the other opportunities or avenues where you can practice your skill after training in South Africa? And before I give you the floor, the third question would be, what are the specific challenges that you face as a trainee in cardiothoracic surgeon, as a female surgeon? So I think there are some specific challenges that you might have faced. So I think if you can enlighten and also you can encourage all the amazing ladies that are present with us here, I think it will be a great fit and it will be of great benefit to us, to those who are attending this session.
So I think let me tackle your first two questions. So the College of Medicine South Africa qualification is quite widely recognized. In terms of, let's say you want to move abroad to Australia, it is comparable. So in terms of, they look at your logbook and see how many cases you've done, but it's an easier way to translate to the Australian system with a College of Medicine South Africa qualification, as well as, and so in the Australian system, they usually give you a provisional registration, and within a year, you should qualify for a full registration. And I think that's the same with the Canadian system, except you have to write a few exams to enter the Canadian system with the College of Medicine South Africa qualification. But in terms of doing fellowships elsewhere, whether in the United Kingdom, in Australia, with your College of Medicine South Africa, you can go straight into a fellowship program with not much issue. America, obviously, there's always that challenge of having to write USMLEs that you will have to do even with a CMSA qualification. But a CMSA qualification is quite widely recognized. I think that's the first thing. I think the advice I would give, or the challenges as training for females, firstly, obviously, there are very limited training centers. Some in West Africa, some in Egypt, some in Kenya, and then South Africa, and nothing else anywhere else in the African continent. So to train, you're going to have to leave home likely. So my advice is really plan out and strategize how you're going to do that. Unfortunately, society and pressures, things like motherhood, things like marriage. Things are all these things you have to consider more deeply and more thoughtfully than, unfortunately, a man would have to do so, because training in cardiothoracic surgery is very time demanding. It's as your days are very long, and also the program is quite long itself. So it's something that you have to be cognizant of in terms of the other things you want to do in life, whether that's getting married or having children. It has to be planned out. And that's the only real good advice I can give. And there will never be balance, unfortunately. And I think it's the myth that young female surgeons are sold, that you should be able to achieve balance between work and home. It's not possible. There will always be something that may not necessarily be balanced. So it's always to think of synergism. It has to be just synergistic and find a homeostasis point. Thanks.
Thank you very much, Dr. Kudze Kenyepi, and thank you to all our panelists, Professor Hussein, Dr. Kelechi, Dr. Sununa Hassan, and it's really an amazing. We're really grateful for the insight and for the detailed explanation about the various training programs in and around Africa. And now we are really clarified. On my part, I'm really clarified about the training programs and which country to consider when pushing my training in cardiothoracic surgery. I think we are exactly on time. That is, we started at 5 p.m. and the session was to last for 1 hour 30 minutes. So by my time it's 6:30 p.m., which is exactly 1 hour 30 minutes. So thank you all for being present for this session, and thank you all for the effort, and thank you very much for giving us your time, and out of your busy schedule you decided to be able to highlight us and train the next generation of African cardiothoracic surgeons. Thank you very much. I think without further ado, we're going to close the session today, and see you all in the next session. Thank you very much. For those who are asking questions how to join the Association of Future African Cardiothoracic Surgeons, I dropped the link to the WhatsApp group in the chat box. You can join our WhatsApp group to get more information. Or maybe you can go directly to our website, that is Apart Africa, and you have more details there. And the those who are going to launch the call for those who will be interested in working in leadership position within the association. So thank you very much for your time, and thank you very much for being present. Have a great evening, and to you all.